COVID-19 myths and facts. COVID-19 is a new virus which has spread quickly in many countries around the world, including in southern Africa. Knowing the facts that COVID-19 symptoms, how the virus spreads, and what you can do to stop it will help protect you and your community. I do recommend to wash your hands and cover your mouth and face when you sneeze, and sneeze into a tissue and throw the tissue in the garbage. There is a lot of misinformation about COVID-19, so it's important to check information has come from a reliable source such as World Health Organization or your government health authority. Coronavirus COVID-19 is a new virus which has quickly spread around the world, with Italy mainly affecting Asia, Europe, and North America. More people are now testing positive in southern Africa. This is also where the largest number of people are affected by HIV. Misinformation myths have been spreading fast, so we ask community health workers from across southern Africa share the most common COVID-19 myths and misinformation they have heard. We put the record straight. Well, most people who get COVID-19 get very sick or die. Fact, most people who get COVID-19 will have a mild form of the illness and recover without needing professional medical care. Around 8 out of every 10 people with COVID-19 will have mild symptoms. Around 1 in 6 people will become seriously ill and need hospital care. Scientific modeling suggests that around 1 in 100 people who get COVID-19 will die. Can you always tell if someone has COVID-19? Fact, no, the virus can be in someone's body for up to 14 days before they get symptoms, and some people will have such mild cases of COVID-19 they might not notice that anything is wrong. That's why it's important that everyone follows government advice, including hand washing, using tissues to catch cough and sneeze, and avoiding crowds to stop the spread of the virus even if they feel healthy. Can Black African people get COVID-19? Fact, anyone can get COVID-19 regardless of race or skin color. Older people and people with other health conditions such as asthma, heart disease, and diabetes are more at risk of getting seriously ill. Does COVID-19 only affect old people, meaning young people don't have to worry? Fact, while COVID-19 can be more dangerous in older people, anyone can get it, including young people, some of who become seriously ill. While we don't yet fully understand why some people get more serious symptoms, we do not know the young people are more likely to develop serious symptoms if they have certain underlying health conditions, for example, have asthma, heart conditions, or untreated HIV, then they can get very sick. Are people living with HIV more likely to get seriously ill? Fact, if you're living with HIV and on effective treatment, there's no evidence that you're at higher risk of developing serious COVID-19 symptoms. This is because your treatment will be keeping your immune system strong and your body able to deal with infection. If you're worried that you might have HIV, now is a good time to get tested so you can start treatment if you need it. Prevention, treatment, and cure. Well, antiviral treatment are for HIV stop me getting COVID-19. Fact, there is no evidence taking anti-HIV drugs will stop getting COVID-19. Although some ART drugs are being trialed for use to treat COVID-19, there is no evidence yet for the effective of this purpose. If you're living with HIV and taking treatment, it's important that you follow general advice to reduce the spread of COVID-19, keeping taking your treatment to ensure your immune system stays strong. You should share your HIV drugs. You shouldn't share your HIV drugs with anyone else who has COVID-19 or is worried about getting it. These should only be taken if prescribed by a doctor. Here's a fact that people make a myth about. Can COVID-19 spread in warm, sunny weather? Fact, COVID-19 can survive temperatures higher than 25 degrees Celsius. You can catch it no matter how sunny and warm it is. So whatever the weather, you should follow the official advice to protect yourself from the virus. Get out in the sunshine if you can. It's still a good idea that helps your body provide vitamin D, which is important for your immune system. Will drinking lots of hot drinks stop COVID-19? Fact, there is no hot drink, hot or cold, that will protect you from COVID-19 or cure the illness. So far, there's no proven cure for COVID-19, but most people recover by themselves, taking paracetamol, drinking lots of liquids, and getting enough rest can help you manage your symptoms. Should I use a strong disinfectant to clean my hand and body to protect me from COVID-19? Fact, you shouldn't use strong disinfectants to clean your body. Washing your hands freely with soap and water or rubbing alcohol-based sanitizers on them will stop the virus spreading. Using stronger chemicals on your skin can be dangerous. Never drink disinfectant or hand sanitizer, as this can do serious damage. Can chlorine cure COVID-19? Fact, at the moment there is no proven cure for COVID-19. But most people will recover on their own without needing professional medical care. If you think you have COVID-19 and are having difficulty breathing, contact your local health facility, as you'll need professional medical care.